It sounds a little bit crazy, but I mean, I really believe we can change the world through loving each other. And I think in medicine, so frequently we deal with disease processes, pathophysiology, that we're not really taught about how to empathize, how to provide therapeutic compassion. I mean, it is a magical moment. It's a moment of this human connection that we forget about. And that's something that we try to have every day with our team here. It's something I try to do every day with my patients, is make sure that I'm fully opening my heart to them so that these conversations are very frequently like a dance, where you move forward trying to tell all the truth, and then you have to pull back just a little bit because maybe you told a little too much. But we were just slowly doing this little dance, walking through, going forward and back, figuring out how can we get through this process of helping them be prepared for their child's soon coming death. It's this power of connection. It's the power of compassion. Compassion and caregiver, I think, is a little bit redundant because I think it needs to be so core and central to clinical care that we provide that compassion is just who we are, that I wish we didn't have to say them. But right now you have to say both of those together, don't you? Compassionate caregiver. Open your heart, lean into suffering, and be willing to be changed by what you hear. All of us will be better for it. We can make this world a more compassionate place together.
There's so many advancements in science and medicine. We have to be careful that we don't lose the humanity in the care because of those. It's really being present with people, being present with your patients, but it's also the staff with whom you work. So our goal is to really be with you, listening to what you need, what issues you have, what you don't understand, and most significantly, what's most important to you in whatever set of circumstances is going on in your life, and how do we support you in that. In our health system, that connectedness isn't always there, and it should be there. It's really about effective communication for starters. The more you feel heard, the less anxious you're going to be about making yourself heard. And the more you feel empathy from those around you, the easier it is to feel like, okay, they're going to take care of me. Because it is one of the most vulnerable times a person can have is when you don't feel well. Every single patient matters. And when I'm in your room, you're the only one that should feel like you matter. You shouldn't feel like I have one foot out the door because I have to go see somebody else. Whether it's just your presence next to them, whether it's a hug, something clinical, something spiritual, whatever it is. And that's what this work is about. If we lose the humanity, then we failed.
What's never lost on me here in radiology is that people are coming here very stressed out, really stressed and scared. And they're about to find out, one way or the other, a situation that's going to change their whole life, probably their family's life. It's not always easy in a hospital, right? We do very invasive procedures. One of the best part of my jobs is wrapping a warm blanket around people in the radiology department. It's always so cold, and wrapping a blanket around someone's shoulder is kind of like giving them a big hug. That's what that feels like for me. Their comfort's important to me, their family's comfort is important to me. That's actually a gift for me to be able to sit with someone in that kind of vulnerability. You know, I think it's a gift for us as healthcare workers. I think people heal in connection with other people and in relationship with other people, and there's so much more you can get out of this job, just being grounded and compassionate towards your patients. I think we need to make the time for that. I do think that gets lost by the wayside, but I think it's critical. I think compassionate care is critical to the well-being and healing of the patient. I kind of feel like that's why I was put here. I feel like that's my purpose. I do. And that's kind of how I try to live my life.
One of the ways I try to help my families is singing to them. And I've sung for my patients when we've lost them, for their family ask me to sing for them. It's a way to, I think, show compassion. I think in music it's a very different language that's universal, and you can show a respect and dignity for that person with song. Compassion is much more, though. I think you're actually with that patient, suffering with them in a sense, because you just can't have empathy and put yourself in their shoes. You have to actually suffer with this person to ameliorate it if you can, and if not, then somehow help them bear it, and bear it in a way that they understand that you get it, and understand and help them in that suffering. Because we can't cure everything. You know, we have patients die, but we hopefully are compassionate enough so they feel, you know, we know you tried everything, but we're so grateful of what you've done. Listening is so, so important. I think it makes me a better person to understand not just what they're saying, but also their body language, letting them have the space just to feel comfortable, to feel like you're really, really caring, to have a very close bond where we can share each other's joys and sorrows.
I think nothing matters more than compassion in healthcare. I think it's how we treat each other that really is at the epitome of living well and even dying well. I meet people at their maximum stress because they've just heard the word cancer, and that is just a bad word in any context. Traditional medical training teaches about disease processes, teaches about physiology. It teaches less about humanity. Treat people the way you'd want your family treated, the way you'd want your loved ones treated. Listen to your patients, watch your patients. They're giving you so much information in a very short conversation or with a very short look, if you're paying attention. And if you don't hear what they're saying, then you can't help them make the best choices for themselves. And I think part of empathy is working with patients to help them make good choices, to help them feel comfortable in their decision making, to help them feel comfortable with the treatments that they are accepting for themselves and for their body. So I really would put the two hand in hand. I think if you're not hearing what people are saying, you can't possibly empathize with them or understand where they're coming from. I love my work. I feel so lucky to work with the colleagues I have, and I meet extraordinary patients, mostly extraordinary women, every day. So yeah, I feel really passionate about what I do.
I have a hard time imagining my industry without compassion. I think it's everything from the very introduction to how we sit with our patients to how we communicate with the families. One of the things that I value is being genuine. There are definitely moments that will be difficult. There are moments where I will acknowledge in a moment with a patient that it is difficult, and in that way modeling also for them a way of fully experiencing those emotions and being present with them. I think sometimes we have this idea of doctors being kind of like blank slates and not entering that space, and part of my work is entering that space for my patient. Our relationship with these patients is fundamental, if not crucial, to this treatment. This is a setting that can be at times heart-wrenching, at times scary, and what we bring to the table is hope, and that's what we inspire in our patients. I think compassionate care does require some amount of risk-taking, some amount of willingness to go to a place that will be difficult and at times painful, and I think some amount of reflection and self-care allows you to more fully enter that space for your patient. I think recognizing that it is an active process. It's not just how we're experiencing our patient. It's not just about empathy and sympathy, but it's really about being fully present in a way that is dignified with a patient does mean compassionate care to me. I can't think of a better way of impacting other people's lives right now.